You're listening to Community Health Watch on WNHHLP 103.5 FM, New Haven's home for community radio. Insightful conversations, impactful ideas, and voices shaping our community and beyond. Let's begin the dialogue.
Welcome to today's program. We're shining a spotlight on an issue that affects millions, the connection between diabetes and eye health. Whether you or someone you love is living with diabetes, understanding how it impacts your vision is key to staying healthy. So today we're looking to break down the risk, share some expert advice, and highlight simple steps to protect your sight. Stay tuned, your vision matters. Today's show can help you keep it sharp. So I want to welcome first our guest, Dr. Kristen Wanyawu. She is Associate Professor of Ophthalmology and Visual Science at Yale University. And I am the Reverend Dr. Darrell Blue, pastor of Little Rock Amy Zion Church, Charlotte, North Carolina, and Cultural Ambassador for the Yale Clinical Research Program. So we'll first start, Dr. Wanyawu, can you first tell us a little bit about yourself and what inspired you to specialize in your field?
Sure. Thank you so much for having me. It's so exciting to come and to be able to talk about our work and to try to keep people healthy. I was inspired to study eyes because it was the only thing that I wanted to do in the middle of the night when I was in medical school, which seems odd, but I just thought it was so interesting. The ophthalmologists are the happiest surgeons you'll ever meet. We get to have long relationships with our patients, and if they have a problem, we get to fix it. Diabetic retinopathy came to me because I said, okay, I love the eye. And I'm an activist at heart. So when I was in college, I worked with the Black Student Union to do activism around education, equity, affirmative action. I'm from Michigan. So I was at the University of Michigan organizing buses to DC and, doing all of the protesting there. And in my real life, I had to figure out how I was going to knit those things together because as a doctor, I knew I was going to put all of it together. So as a health equity researcher, I looked to say, okay, where do I think I can have the most impact? When I was in residency looking at diabetic retinopathy, I was in Ann Arbor, Michigan, college town. They really don't have advanced disease. When I looked at the data, though, I saw that it was people that experience racism, people that experience poverty, people that are immigrants that had the worst outcomes. And when I asked questions about why that might be, my attendings didn't have answers based in science, right? Their answers were, oh, you know how they are, or you know what that population is like, which is really steeped in racism or our concept of who can, see or who gets well and who doesn't based on the color of their skin, which is inappropriate and not good science. So I realized that I was going to have to go and figure that out. I did my training in the University of Illinois at Chicago because I wanted to be able to treat the very worst of the disease, which is in communities that have limited access to care, that experience racism, poverty, etc. I realized there that the manifestation of diabetes in the eye was so much more advanced than what I saw in my little college town. And I started myself on the journey to try to figure out what was happening, but not only what was happening, what could I do about it? And my first job talk was about contextual factors or social determinants of health. And since then, we've developed interventions, engaged with a lot of different communities to try to figure out how we can get people seeing and saving their sight.
Thank you so much for the introduction and going into detail about why you are doing what you're doing. So kind of piggyback on what you were talking about at first, what are some of the most common eye problems that you see in the clinic when people come in?
Yeah, so just in general, the number one problem is just refractive error. And then when we talk about changes in glasses prescription related to diabetes, if you have someone that has challenges with their blood sugar, what they'll tell you is when their blood sugar is high, their vision gets blurry. And what's happening there is when you have increased sugar in your blood, it changes how the lens, which is the focusing mechanism in the eye, is hydrated. And so what that does is it changes how you see. So, the first manifestation is, that refractive error, that change in glasses prescription. People with diabetes also have increased cataract. They have cataract earlier than other people.
Okay.
The main things that we talk about when we talk about diabetes related eye disease, though, are swelling in the back of the eye
Hmm.
and abnormal vessels that are often called proliferative diabetic retinopathy. I like to explain this by talking about the whole body because we have to remember diabetes is a systemic disease. When you have high blood sugars, it causes inflammation in the eye. So think of inflammation like if you get a cut or if get a mosquito bite or something like that, inflammation throughout your whole body.
Hmm.
And each organ, each body part responds to that differently. In the eye, what happens is that there is a signal that says, you know what? We don't have enough blood flow because of the vessels. And that's that same signal that the heart gets that causes heart attacks, that the brain gets that causes strokes. And the signal in the eye does the same thing and says, you know what? We're just really not getting enough blood flow. And
Right.
that signal, what happens is the vessels don't work properly. There's cells called pericytes that are supposed to protect the vessels, and they die when you have high levels of blood sugar. And so what happens to those vessels is that they bleed and then they break. So you end up having the liquid that's supposed to be inside the vessels outside. And then that's how you get what we call macular edema or the swelling. And that's also how you get the environment where abnormal blood vessels grow. I always say that the only time you're supposed to grow eye vessels in the eye is when you're being made, right?
Oh.
That miracle of a human being made, that's when you're supposed to do it.
Uh-huh.
If you have vessels in your eye any other time, that's not going to be good. Other places, we love new vessels. So if you have a heart attack, yes, new vessels to try to make new pathways. You have a stroke, yes, new vessels. Eyeballs is just not really designed for that because everything has to be clear for you to be able to see. When you get those new vessels in the back of the eye, what happens is they grow along what's called the vitreous humor. And the vitreous humor is a gel that your eye is formed around. And what happens is that retina, which is that thin sheet on the back of the eye, gets pulled off by these weird vessels that kind of grow and then they crumple. And so that's where the blindness happens from diabetic retinopathy or diabetic eye disease. And so when we talk about what are the risks of blindness, those are the two main things that really cause disturbances in the vision is that swelling from the vessels where the fluid is where it's not supposed to be, and then also from those abnormal vessels that grow and they bleed and they break and they pull off that retina, which is that really thin, fragile tissue, thinner than a sheet of paper, that is supposed to be able to line the back of the eye.
Okay. Well, let's continue with down that vein of conversation about being able to diagnose this. So, how has artificial intelligence and robotics changed the way eye diseases are diagnosed or treated?
Sure. I mean, ophthalmologists love technology, and we actually were the first field by Dr. Abramoff and his colleagues to have a code that is developed for artificial intelligence to diagnose a disease. And so there is a machine or several machines where they take a picture of the back of your eye and the machine can tell you whether or not that you have diabetic retinopathy that we worry about or not. And that is a new advance within the last few years that will really help us with our challenge of screening. Like, how do we tell who has what and how do we get what we need? Artificial intelligence has really allowed us to be able to do that in ways that we haven't seen before, which is fantastic because we need as many eye exams as we can get, and they're a limited supply, particularly when we think about our rural neighborhoods or areas that people don't have access. So it's much easier to get somebody to a camera than maybe get them to a professional that is able to do that.
Right.
Where our lab does our work is trying to figure out, okay, we know someone has something. How do we use technology to be able to keep them in the system? So there are also some wonderful work out of Los Angeles County where they have thousands and thousands of people with the most devastating type of eye disease. And they noticed the challenge was who to pick out of this long list of people. And so Dr. Daskovich there and Dr. Ogunyeme there, two wonderful, amazing scientists, women, they figured out how to use characteristics or variables or things that systemically that we would know about a person to try to figure out who gets what. So how to risk stratify who gets what exam and how fast to do that. And they've been doing that for many years. So that's another way that artificial intelligence helps us to figure it out. That technology that they use has not become mainstream. But I wish it would be. So I think over as we kind of move and our understanding of artificial intelligence becomes really strong, we'll be able to leverage, okay, who needs what when, right? How to get people the treatments and the assessments that they need, and how do we fit that into someone's life? Because that is the challenge of diabetic retinopathy in general.
Thank you for that. A lot of people think because they have 20/20 vision or even 15/15 vision that everything is well with their eyes. So, can you talk about what are some early warning signs of either vision loss or eye problems that people should not ignore? And they definitely should come see you.
Well, if you have diabetes and you are having or experiencing blurred vision, you should definitely see an eye care provider right away. Our challenge with diabetes related eye disease, though, is that oftentimes there are no symptoms. So you can, just like you said, be 2015, that's almost like superhero vision, and still have really, really devastating advanced disease in your eye. One of the things that we studied in our lab is we went to ask some of our local community members in New Haven if they could help us kind of refine our screening or kind of figure out what we were missing. And one of the things that came up was people that see well are much less likely to go and do their routine screening. The American Academy of Ophthalmology recommends that everyone be screened yearly, annually for diabetes. The American Diabetes Association has some caveats to that. If you have excellent blood glucose and haven't had any problems, they give you a couple years. But most people should have at least some eye exam. And if you have had ever any changes, you should definitely be seen at the least once a year. But what we found is people that see well have a lot of other things going on, and it doesn't get the priority that it needs. So how do we figure out how to make sure people will elevate that eye exam on their list? And so what I will say is, if you have diabetes that needs a lot of help by your care team to get controlled, so that's hemoglobin A1Cs of 9% or above, or if you've had organ damage, so if you've had a heart attack or a stroke, if you're on dialysis, if you've had a foot ulcer. Diabetes, remember we just talked about, is happening in your whole body. So your eyes are there too. We did a study about over 10 years ago now where we were trying to look at the systemic characteristics to try to see, what are the clues that you may have a problem with your eye. We found in that study that people that had a foot ulcer were also likely to have challenges or progression in their eye disease. And so for us to be able to know those kinds of things, it's really important to try to elevate those clues to try to get people where they need to be, because we've been able to decrease blindness from diabetes for over 40 years. We know what to do. We have the tools, and it's very, very unlikely, if we catch you in time, that you will get to the point where you're, blinded. If I catch you late, though, we're behind. And so I always tell my patients, if I'm catching you and I'm worried, it's almost like you're kind of heading down a roller coaster. And
Right.
I'm like I'm trying to hold on and stop you, right? But if I get you, early, then I can say, oh, I see a little something. Let's see you in a few months. And
Hmm.
then we can keep you with that sight. And it's a real challenge for a lot of my patients, excuse me, to try to fit all of those things in. A lot of times people with diabetes, they have other challenges. They have a lot of doctor's appointments. They have other life things. Dr. Tarika McCall at Yale calls this life flow. How do you
Right.
figure out how to get it into your life, right? And so we
Right.
have our scene program intervention that helps people to do that. But I think that's where our challenges are, is like, how do you figure out something that you don't have any symptoms for? How do we make it a priority?
Right. 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 Um, Can you speak to the importance of, and you hinted it, of the importance about diet, lifestyle, which helps to maintain your healthy eyes?
Absolutely. All of our data support the fact that if you can maintain your diabetes in normal range, right? We have so much technology now that is really helping us to understand that minute by minute blood sugar. And so my colleagues in endocrinology and primary care, they say, okay, are you in range? And that really helps your body to be able to manage the blood sugars. So as we figure out, how the different organs are impacted, that's going to be the number one thing. And it's not easy. I discuss this with a lot of my patients that diabetes is everywhere. So I think a lot of people think it's something easy just because it's common, and
Right.
it's not. And everyone's journey is quite different. So
Mhm.
absolutely, whatever your team, and usually people need a team, says that's important, that's your nutritionist, that's your primary care. You may or may not have an endocrinologist. How can you move your body with a way that makes sense? Also, with resources, limited resources, it can be really challenging. Some of my patients have talked about maybe being the only person with diabetes in their family and having to try to figure out how to make food for the whole family that is good for their blood sugar. That's a challenge.
Yeah.
Or with the days of increasing grocery prices, and understanding what are the things that are good for your body, but also what are the things that are good for your budget, right?
Right.
Also, I think culturally, I come from a Black American tradition, right? And a lot of our cultural foods may not be as healthy as we want them to be. So how can I, prepare the things that culturally make sense for me in
Mhm.
a way that my body will be grateful for, right? So, I think those are the types of things that we're learning, and generations of us are learning on how to do that. But I think also just a lot of my patients just kind of that acknowledgement of like, okay, we can do it. It's not going to be easy, but there are little steps that you can take to be able to make it happen. Um, for this work, we worked with Dr. McCall. That's the Chill Lab. We run the Scene Lab, Site Saving Engagement and Evaluation in New Haven Lab. And
Okay.
we interviewed participants to try to ask them what were the things. And these were some of the things that came up. How do you prioritize it? How do we have those conversations with our doctors? What are the foods that I can afford? What are the foods that I can eat that make sense, that will be delicious and nutritious? We
Right.
know that if you can keep that blood sugar in range, if you can manage all of those things, it is less likely for you to have challenges and blindness from diabetic retinopathy. There's a
Okay.
caveat to that. So my patients ask me, they say, but doc, my blood sugar is great now. And
Mhm.
I say, but vessels have memory. So
Right.
we are so grateful that yes, your hemoglobin A1C is 6.5%, which is excellent, 7% excellent, right? It was 15%, or it was 18%, or maybe even off the chart, right? And so
Right.
the sooner you can get that into range, we're grateful. And your body has still experienced that. So we
Mm.
have to figure out how to manage going forward, and that part is important. Also, the longer that you've had diabetes, the more likely that those vessels will be challenged, even if you've done an immaculate job at maintaining your blood sugars for 20, 25 years. After 25 years, most people will have some kind of retinopathy in there.
Right.
And that part is important too. So, I don't want to, there's no shame. There's no, I don't want you to get discouraged if your doctor says, oh, I didn't see anything last year and now I have something. Just be encouraged with your work and your efforts, that we know what to do. Even when you have some changes there, we know what to do and know how to keep you seeing.
Appreciate that and that response. I'm sure you've seen patients from various age groups. So, as it relates to vision care for children, adults, seniors, is there any difference within those age groups as far as eye care?
Sure. It looks in diabetes, it looks the same. So
Okay.
if you have diabetes juvenile onset, or the type 1 that comes from challenges with those cells that manage the sugar, um, it looks the same as if you've gotten it in type 2 diabetes, where you just get the resistance from how your body manages sugar. That being said, it takes a long time to get the damage. So remember how we talked about it happens. You got the inflammation in your body, the inflammation impacts the vessels, and then the vessels don't work well. That process takes years. So our guidelines reflect that. So if you have type 1 or the kind that usually comes in kids, then those people usually don't have anything for at least 5 years. So you have some time. The challenge with the insulin resistance kind or the type 2 kind that other people get when they're older is you can have diabetes without knowing you have diabetes. And maybe you've met someone like that where, they do, they all of a sudden they have this event and they find out they have diabetes, but they probably had it years before. So that's why when you get diagnosed with type 2 diabetes, you're supposed to get an eye exam as soon as we can, because you may already have changes that need addressing. I have people every year where they find out they have diabetes because they have bleeding in their eye, which means that they've had it for a long time. And I would argue that in our wonderful country, America, that shouldn't be happening. We shouldn't have people that have those late manifestations of diabetes that come to us without knowing. We really need to make sure our screening systems are more robust so that we can make sure to keep our humans healthy. Reverend Blue, would you mind repeating that for me? You may be on mute. Let's see.
I'm sorry. Yes, I
Okay.
was on mute. I'm sorry.
It was
Yes.
so great.
Look,
I was like, oh, this is a good one. And I just couldn't hear you. I'm sorry.
I'm sorry. I say with the rise in screen time and digital devices, um, does it impact those who are diabetics versus those who are not diabetics? Is there a great larger impact with the screen time, digital devices? Because how does it impact vision, period?
Sure. I haven't seen any data about diabetes and screen time in general.
Okay.
There's a whole body of literature in pediatrics about looking up
Mhm.
close and nearsightedness, especially out of Asia, where people are very nearsighted and they actually have public health interventions to try to get kids playing outside and try to look in the distance. And there's even some eye drops that people have started doing to try to keep people from being too nearsighted in kids. As after your eye is fully developed, this is not something that happens. But I haven't seen anything in the diabetes literature about screen time. Although I will also say this, diabetes is a systemic disease that also causes challenges in your nerve endings. So people with diabetes will often have dry eyes because of the nerve endings.
Mm.
And so if you are driving, if you're looking at a screen, you may experience some irritation more than other people if you have diabetes.
Okay, that sounds good. Thank you so much. I'm always interested in that because I know I was one who had 20/20 vision and mine started progressively getting worse over time. I was like, what in the world? But I
Um,
was eventually nearsighted, but you find out. Okay, so you personally, do you participate in any outreach or educational programs to promote eye health awareness in the community? So how do you engage the community to bring awareness to what you're talking about now?
Sure. Our work is mainly out of our research lab. So we run the site saving engagement and evaluation in New Haven lab, which is the SCENE lab. And it started with our team interviewing people in primary care clinics in New Haven to try to understand how we can do a better job keeping sight, saving sight. And so we created, based on our interviews, a framework to help our understanding of how people experience that screening process and what are our challenges and how do we figure out how to navigate them. What happened then is that we created the SEEN program, and the SEEN program was to try to figure out people that are at high risk, so not everybody, can we find them using some of the characteristics that we talked about? Did you have a problem with a stroke or heart attack? Did you have any other challenges related to diabetes? What's your hemoglobin A1C? Those kinds of metrics. And
Mhm.
say, can we figure out how to elevate the eye exam on your list and help you with your other list? So we also know that people that are more likely to go blind also have increased social needs and social determinants of health. So we partnered with Project Access New Haven, which is a local organization that specializes in care coordination and patient navigation. So we partnered with them for our group of people to see if they could help get people that hadn't had an eye exam in a year, that magic number when people should have had it, and can we keep them in the system, and then could we get them to come back? And not only could we do that, so 70% of the people we kind of kept in touch with, 40% more people had an exam than they did in the last year. But what was interesting about the people that stayed in the program is they dropped their hemoglobin A1C by a point, just come from talking to people. We didn't change their diet. We didn't do any of those things. We just gave them somebody that would help them with their social needs. So transportation, food security. Some people just wanted to know what to make. We talked about diet and diabetes. They said, so we, had some of our team look for culturally appropriate recipes that were also really good for your blood sugar. So that didn't spike you too much, but also tasted delicious. So those kinds of things. So we engage in the community to try to figure out how to build our interventions and how to build things at our institution that makes sense.
Mhm.
Also, we do some dissemination. So we've held something called, we call it Seen Together. We have another project where we worked with community members to try to build a digital health tool, something that they could use to help them manage this process. Through that work, we learned that our community members wanted to be able to do this together. So we would start talking to them about some of the work they were doing that we were doing, and they would say, "Well, this can't just be for me." As you
Uh,
know, our communities are, right? The Dixwell community is a historically Black community,
yes.
and they would say, well, I can't just have this on my own. I need to share this with other people. So we had a scene together where we invited endocrinologists to come and talk. We also had our digital health tool that we were building, so people kind of respond and say, I like this, I don't like this piece of it. And our hope is to be able to continue to build something that makes sense for our communities to be able to help keep people seeing, but also keep people alive. Because diabetes is a big source of challenges in your life, but also, of our mortality in our community as well.
Thank you. I want to take a station identification break and remind people that they're listening to YCCI Community Health Watch Show on WNHH 103.5 FM. Want to ask you next. So, what is the most rewarding part of your job?
Oh, it's the people. So what I didn't say is that I see patients, I'm a retina surgeon, and I came to medicine because of the people.
Yeah.
I'm good at science. I really like science. And my favorite part is being able to help usher someone to their best vision and going along that journey with someone. And then in terms of the science part, I just love our lab. I love how we are viewing the world and how we are kind of taking the ideas from well, almost not even taking from, I would say like growing ideas with our communities and saying, okay, did we hear you right? Okay, is this the way this should go? Or, how should we, channel this or move this? A lot of times, especially we're at Yale, so especially in ivory tower academia, we kind of say, yes, you're welcome. This is what we should be doing. But we oftentimes don't have proper answers. I always say, if the answers were here, we would have done it already.
Right.
But I would argue that most of the answers that we really need are in community. So how do we figure out how to build those pathways and how to build those bidirectional pathways? That's what we call them, where, I use my Yale power and I say, okay, here's what we're going to make. And then community uses their lived experience and their community power and says, nope, it should be this way. And then I take it back and I put my Yale on it again, right? And then all of a
Right.
sudden, we're ping ponging back and forth and we build something beautiful that neither could have done on their own. And so I think for me, community and humans from like a lab perspective, but also from a patient perspective is just such a gift. And it is such a great existence. And I don't take it for granted. There's so many people that don't get to spend most of their time doing things that they are really, really into. And so, and I do, and people can tell. They're like, oh boy, you like this, don't you? People that meet me for the first time, they're like, you're into this, huh? And I'm like, absolutely, 100%. And it is
Oh,
such a gift because how many people get to do that, right? It's very rare. So I'm grateful for
that's right. Thank you. So I want to ask you to bring some clarity because many people confuse what you are with an ophthalmologist with optometrist. So
that.
can you explain the difference for our listeners?
Sure. So, optometrists and ophthalmologists are members of our eye care team. Optometrists, they go to optometry school, and then optometry school is 4 years where they really do a deep dive on the eye. They, focus on generalized eye care, refractions, contact lenses, things like that. They're, are versed in what do eye diseases look like. They understand glaucoma, they understand, diabetes in the eye. Ophthalmologists go to undergraduate for 4 years, and then we go to medical school. And then after medical school, we train again and go to residency and learn to become surgeons. And I took an extra stint after that to go and learn how to be a retina surgeon, which added 2 extra years on that. So I could learn how to do surgery because there was nothing else that I would want to do. And so I think that part is really important because we need to have our surgeons doing the surgery because we
Mhm.
understand, and we took a really long time to learn how to do that, right? For me, it took 6 years to learn how to do all the things that I do. And we need to understand as a team that there are a lot of eyes that need care. And so, what are the ways that we're going to work together to be able to do that? And so, our optometry colleagues are really helpful in screening for eye disease and hopefully can get you to the right place because it's going to be an ophthalmologist that's going to need to treat your eye disease. And that part is really important. But without the entire team, we're not going to be able to make this work and make a dent in the blindness.
Right. So we can close with these last two questions. So, finally, what message or advice would you like to leave with our listeners about taking care of their eyes and their vision?
I think the greatest thing is just to remember it. And the reason I say that is how beautiful is it that you have an organ that you don't even think about. For those of us are that are sighted, it's not something we often think about,
Right.
which is fantastic. But for my individuals with diabetes, at least once a year, I want you to remember and prioritize having someone take a look at it or having that picture taken. And if you have to cancel your appointment, go ahead and make another one. A lot of our patients with diabetes have a lot going on, and it's really hard to figure out how to prioritize the eye exam. Another thing that comes up too is that there's a quote that we have that one of our participants said that every time I go to the doctor, I need stuff and I don't want to need anything, which is very true, right? Like a lot of times you go there, you're like, oh, I had all this going on.
Right.
I would implore our listeners to just go ahead and get your picture taken, go see your optometrist, go see your ophthalmologist once a year, because when you're seeing well is the perfect time for us to treat it. It's the perfect time for us to see it and fix it. If you get to the point where you're really already having challenges with vision, oftentimes it is much harder. So please make that time in your schedule and please, take good care of your health and be kind to yourself because diabetes is such a journey and it's a lifelong journey a lot of times. And so be kind as you walk through that journey with your care team and don't be afraid to get back in it, even if you kind of fell off for a while.
Yes. So, and the last question is, where can our listeners find more information about your work and what resources are available about the information that you talked about today?
Yeah, sure, sure. So, we have our lab that's at Yale. We have some resources that are, that we can put in the show notes about how to find us. But if you look for the Scene Lab at Yale, if you Google it, you'll find us. There's only one, SEEN. If you look for my name too, then you'll really find it. That name is long. NWANYANWU, eyeball, that's going to be me. But there's a lot of resources on the American Academy of Ophthalmology. They have wonderful resources. Prevent Blindness is an organization that has fantastic resources on diabetes and patient education. We'll be having a webinar on December 7th about how to, do that with them. Also, Hadley is an organization, if you do have visual impairment, they have a lot of resources for people that have low vision. But and of course, the American Diabetes Association has fantastic resources. And I implore you and encourage you to find those trusted resources. And we love YouTube and we love to go on that auto and see what's happening. But
Right.
those organizations have trusted resources that you can really lean on when you're trying to figure out what to do next.
Appreciate that, because we always want to point people into those spaces that have, like you said, trusted resources, those that have gone through clinical trials and other things that have proven and have the evidence to back the resources. Again, we want to thank everyone for listening today, and thank you for listening to YCCI Community Health Watch show on WNHH 103.5 FM. And Dr. Wanya Wu, thank you so much for taking the time to share with all of our listeners in our community today. And I hope that they learn as much as I've learned on today. Thank you for your time.
Great. Thanks you, Reverend Dr. Blue, and thank all of the organizers. This is such a delight. Absolutely.
All right. Thank you all. Take care.
You're listening to the Community Health Watch Show on WNHHLP 103.5 FM, your home for community radio. Stay informed, stay connected, and take charge of your health.